So something that is that might be very interesting in the future is work on vaccines in pancreatic cancer. So we had a small publication about more than a year ago where like tumor-specific vaccines were fabricated after surgery, and so they were administered to the patients, hoping for a cure. Currently, patients with pancreatic cancer are so they get surgery if feasible, if the tumor is amenable to surgery, and then after surgery you get 6 months of chemotherapy in order to cure more patients. So when we had surgery alone before, we only had about 5 to 10% of patients that were cured, and by giving FOLFIRINOX chemotherapy for 6 months after surgery, it will be around 30% of patients probably that we can cure if we look at the really resectable patients. But that is still much less than the cure rate in other GI cancers. So the personalized vaccine therapy is being investigated immediately in this setting. That is something which we are not used to. Usually we see research for vaccines first, well, for all novel therapies in metastatic setting, but here there have been some data on a specific vaccine that is given after surgery. It's, of course, as a clinical trial, something that is very difficult to set up because we will have to operate on the patients. You have to get a piece of the tumor very quickly to the company that will fabricate the personalized vaccine that needs to be returned to the hospital to start treating the patient. So from a logistic point of view, it's a difficult trial to set up. But we're working on that in like with medical companies and specific sites around the world. We're really starting a global study with this personalized vaccines in this adjuvant setting, which is really a place where we look for cure and not for longer survival. So that's really very exciting.